Korean skincare is less about a secret magic ingredient.
Skincare routine, it's really necessary or not?
So, short answer is
Why skincare is important? Does skincare routines really work on skin health?
when you misuse them,
Yes.
they can also pack a punch the other way,
Okay.
damaging.
Many skincare routines are viral on social media yet.
Be more cautious. Why? Because your skin is biologically complex. Everyone's skin is unique. It's an individual. Our skin has different biophysical characteristics.
Besides home skincare and clinic treatments, what else is important for maintaining the skin actually? If you can give a skincare advice to the audience, then what would it be? We're coming to the acne. Acne is one of the most skin concern, right?
Yeah. After aesthetic treatments, I would say is improper aftercare. We have extremely high UV index. So sunblock, and sunblock again, okay?
Counterfeit skincare products are becoming increasingly common. What's the risk of that?
Eating well, sleeping well, moving well, connecting well. So I'll explain a bit.
Hello everyone. Welcome to our Importance of Skincare podcast series. I am Farhana Tasni, skincare specialist at Cedar Cosmetics. Today I am delighted to join it by Dr. Fatima Kala from Euromed Clinic. In this session, we are discussing about most common skincare questions and the myths that popular and sharing expert insights to make a better decision for your skin health. Welcome, Doctor.
Thank you. It's my pleasure being here.
Okay. Doctor, why skincare is important? Does skincare routines really work on skin health?
So that's an excellent question. So the thing is, what you have to keep in mind is that our skin isn't just for appearance, for aesthetics.
Okay.
It's actually an organ, right?
Yeah.
It's our largest organ. So when you look at the functionality of your skin, that's when you can start to understand the importance of skincare.
Okay.
So our skin, it helps to regulate our temperature. It's a barrier, it's our shield, right? From pollutants, from allergens, from the outside world. And it helps to maintain our moisture loss.
Okay.
So we want to use skincare to care for those functionalities and not to try and replace it or change it.
Okay. So we all know that Korean skincare is very popular yet. From an aesthetic doctor perspective, what makes it different and does it really works?
Okay, yeah. So the thing is, Korean skincare is less about a secret magic ingredient that they've, cracked down and more about their approach to skincare and their philosophy. So because skincare is something that's ingrained in them from a very young age, they brought up with skincare. They believe that skincare is about prevention rather than correction. They focus on the skin barrier, on respecting that barrier. So because of that, that is how it has blown up, and that is why it has gained so much traction. The fact that they want to maintain healthy skin rather than chasing quick fixes. So it's not that Korean skincare is the choice. Go for Korean skincare and you do no wrong. It depends on what you're choosing, and it depends on how it started and why it gained so much traction.
Okay. The famous 10 steps of Korean skincare routine, it's really necessary or not?
Okay. So short answer is no. It is not necessary to have that many steps in your skincare routine. In fact, if you have an actual skin concern, most likely than not, you're going to damage your skin more because you are adding for the sake of adding. However, I do have a lot of patients who come to me and they tell me that their skincare at the end of the day, nighttime is their me time. They find it cathartic. They find it their winding down time. So if you're doing it for that reason and you don't have an actual skin concern that is going to be aggravated by so many products, go for it. I respect that. You deserve that. But if you are doing it because you think, this is the only way I can solve my skin, it's actually the opposite.
Okay.
Yeah. So the whole reason why Korean skincare came up with so many steps is because in Korea and Japan, they have very harsh winters and then they have very harsh summers. So what they came up with is that if they layer multiple lightweight products, that's how they can achieve hydration, sufficient hydration. So if you look back at that, that is a clever idea, right? But if you try and just emulate that for the sake that I need number 1, 2, 3, 4, right? You could end up just putting the same type of hydrating toners or serums and no difference to them, and you can clog your pores like that too.
Okay.
And you can eventually, if you don't choose the type of skincare that that you're buying, you might end up with just water and fragrance, and you layer that on and on.
Yes.
So it's not about the number.
Okay.
Yeah.
So there are so many products on market.
Yeah.
What are the major concerns we must need to follow before choosing a skincare product?
Okay, yeah. So we are bombarded with new products, what feels like every second, right?
Yes.
So it can be overwhelming. What you need to understand is that instead of choosing the product and then seeing if it works or not, you should see, what does your skin need? What are you trying to target? What are you aiming for, right?
Yes.
When you look at that, and then you look at what is your baseline, what is your skin type, what are you working with, then you go to choosing the product.
Okay.
Don't just go for, it's trending, fine. You should let your skin choose for you instead of you telling it what it needs.
Okay.
So it's not about companies, marketing, choosing for your skin. Your skin is the driving force.
Don't go with the viral products, right?
Not necessarily.
Yeah.
Yeah.
Okay. So one of the first step in skincare routine is understanding or identifying our skin type. So can you tell us why it's so important before choosing any skincare product?
So the reason why it's important is because you have to understand that everyone's skin is unique.
Yes.
It's an individual. Our skin has different biophysical characteristics. So it'll depend on how our skin will respond to the same type of product.
Okay.
So people usually assume that, our skin type is oily, dry, and then you have combination, right?
Yes.
It's a lot more nuanced than that. So Dr. Bowen, she suggested that the skin can be categorized into 4 parameters. So she said that you can have oily and dry, but keep in mind, you also have combination, right?
Yes.
Second parameter is sensitive and resistant. But you have different triggers when you're sensitive,
Yes,
right?
Yes.
Then the third characteristic is looking at wrinkled versus non-wrinkled. You have different degrees. And the final characteristic to look for is pigmented versus non-pigmented.
Okay.
But it's not that simple again. Why? Because I have different types of pigment.
Oh, okay.
I have different, how long has the pigment been standing, right? So if you were going to cut it all out and say, okay, fine, I have these 4. If you look at that 4, that means I have 16 different permutations. But
16, right?
Minimum, if you calculate it.
Okay.
But it's not just 4. It's nuanced in between.
Oh, okay.
So now I'm not telling you, okay, now I have so many products on the market and now I need to do maths about my skin type.
Yes.
No. All I'm trying to explain is that what worked for your best friend is not necessarily going to work for you just because you both are oily skin.
Yes. Skin difference.
Yes, exactly. So the main focus is respect your skin. Yours as an individual.
Yes.
When you show it some RASPCT, you will do the correct thing.
Okay. So we are already discussed about that, choosing a product. So what about if we are overusing that?
Okay. So if you're going to overuse, you can disrupt that balance that we spoke about earlier, right? Because our skin is functionality, has functionality.
Yes. Yeah.
So if you disrupt the barrier, you can increase water loss, something known as transepidermal water loss, right? You can disrupt that pH balance, which can lead to itching, irritation, dermatitis, right? So you have to work with your skin rather than trying to give it too much and achieve a result quickly. So the thing to keep in mind is that even those that are called barrier repair, they can paradoxically impair functionality if they're overused.
Okay. It will make the damage on barrier, right?
Yes. So
if you're overused.
Yes. Okay. So that's the point, that it's not necessarily exfoliants. It's also barrier repair products that can be overused.
Okay.
Yeah.
So we are already discussed about overusing the products. So can you please tell me some examples about that, what we can use and not use like that?
Okay. So it's not about using and not using. It's about moderation.
Okay.
Because, so some common culprits, if you want some examples, are those actives, right? So mainly your retinols, retinoic acids, your exfoliants like glycolic, they are strong, they pack a punch, but when you misuse them, they can also pack a punch the other way, damaging.
Using the wrong way, right?
Yes.
Okay. So, in most common people are believing like that, a myth, we can only use the non-comedogenic product. Is it exactly like that or not? Is necessary for using only non-comedogenic product, right?
Okay. So to answer this question, you have to understand that the term non-comedogenic, there's no actual universal regulatory basis for this. Okay. Yes, we have certain products that are more likely to clog the pores and less likely to clog the pores. But when you see that slash on, a skincare product, it does not mean that we have a regulatory body that looks at that. Yes, we have more likely and less likely, but you don't need to focus on that because, like I told you, your skin is an individual. Yes, of course, if you are acne prone, likely to get comedones, I would advise being more cautious and looking for less likely to clog your pores. But it does not mean that, oh, I see non-comedogenic, I'm safe.
Okay.
Do your patch testing.
Yes, exactly.
You sensitive, you prone to comedones?
Yeah.
Patch test that non-comedogenic label.
Okay, so maybe it's mostly affecting the severe level of like inflamed acne, exactly like that.
Not only acne. You can also have patients who have sensitive skin.
Yes.
So sensitive skin sometimes can also be triggered. They're not really acne prone, but they can have a dermatitis reaction.
Yes, okay. That's right. So many skincare routines are viral on social media yet. Can you please differentiate the actual skincare or the genuine skincare routine and the online trends?
Okay. So I would say a way to help differentiate is to be cautious of extremes.
Okay.
So if you see a product that is marketed and tells you that it's going to fix everything.
Okay.
It's going to fix your acne and it's going to fix it in 3 days and it's going to restore your barrier. It's going to do everything.
Okay.
Be more cautious. Why? Because your skin is biologically complex. So it's not possible for something to treat like that. Even in the clinic, we use lasers, we use injectables. With that, you cannot fix in 3 days.
Yes.
So putting
it will
something
take time, right?
Yes. So putting something topically on your skin, how is it going to do that?
So it's just a myth like that we will get the result within 3 days or 4 days. Just we are thinking like that. It will take actually more time, right?
Yeah. So genuine advice, dermatological advice is that skin takes time, takes consistency, takes combination approaches, and that's how you can actually get results.
So the consistency is the main key, right?
Yeah, it's one of the main keys.
Okay.
Yeah.
So if there was one skincare trend you could get rid of, what would it be?
Okay. I would say, there's now, I'm not sure if you've seen it, there's trend going on where they targeting children. They are talking about skincare directly marketed for children. I'm not even talking about adolescents.
Okay.
Have you seen this, right?
Yes.
So it's ridiculous, plain and simple, because unless the child has an actual skin concern, and most common in childhood is what? Psoriasis or eczema, right? And then adolescent time, you're going to start getting acne.
Yes.
So seeing this trend where they're telling children, fetuses, to use toner to balance your pH, you don't need that. Your skin is doing it. So yeah, definitely get rid of that, please, somehow. I don't know if you can.
So we can use only from the adult, or we have the age limit of that, anything like.
So it's not an age limit. It's just that if a child and adolescent doesn't have a concern, what are you trying to balance? What are you trying to achieve? The skin is doing that function already.
Okay, exactly like that. So this one is the most relevant question, I think. Is expensive skincare is always better, or we must need to follow with the ingredients like that? Okay,
so expensive does not necessarily guarantee you better, but also the opposite is true. If you go for something that's cheaper, does not mean that, the expensive is trying to cheat me, right?
Yes.
No. More than that, yes, like you mentioned, okay, look at ingredient list. But you have to keep in mind, you can have 2 products, same ingredient list, right? Yes. Same price point. Let's take away the price difference. Same price point. But the efficacy is going to be different. Why? Because their formulation changes slightly.
Consistency, okay.
Not just the consistency. I'm not sure if a lot of people are familiar with this. There's the job of the cosmetic chemist. Right?
Okay.
The way that it's formulated can change regardless of the same exact ingredient list.
Okay. It's like that. What are the biggest skincare mistakes that you commonly see patients making?
Okay, so I think we did touch on some. So for instance, the overuse, like
Yes,
you had
overuse.
mentioned. Chasing trends
Yes.
is another one. But other than that, I would say sticking with a product.
Oh,
So
okay.
consistency.
Okay.
I see a lot of patients will come, and when you go through their history and their product history, you see they've tried everything.
Oh,
And I mean
okay.
everything. But then when you ask how long, it's been like, oh, I tried this 1 or 2 times. Did you have any irritation? Was there any problem? No, I just didn't see the results.
So don't keep in the consistency, right?
Yeah, exactly.
Okay. We touched on consistency.
Mhm.
Can you please elaborate that? How long we need to use this
Mhm.
a single product?
Okay, so it depends on the product we're going for and also the result we're trying to achieve.
Hmm.
But if we're talking about realistically,
Hmm.
for instance, if you are starting, retinol is now very, very popular, right? So if you're starting your retinol and you want to see some change,
Yes.
you should actually be waiting around 8 to 12 weeks
Okay.
to see your results.
8 to 12 weeks, right?
Yes.
Okay.
Yes, you will have some change in parameters within the first 4 weeks in terms of you'll have a bit of glow, you'll have that change, but no, to actually see change, 8 to 12 weeks.
Okay, minimum 12 weeks, right?
A minimum 8. Everyone's skin is different because
Okay.
then also you have to factor in, are you starting from 0 days to 7 days a week? I hope not. I hope you're not going for
I can
0
understand.
to full force. But consistency means once I've developed tolerance to that and once I'm able to use it more frequently. So that's when you can start seeing the results.
Okay.
And for instance, if you look at something like acne, some acne will actually have a purging phase first. So you're not going to see
like breakouts?
similar to breakouts, but you have to be very careful because a patient sometimes can come and think that, oh, I continued using a product because I thought I was just purging.
Yeah.
But instead they were having irritation to the product.
Okay.
So
you're thinking like that actually.
So you have to be careful and not try and be like, no, you told me consistency. I need to push through. But instead they're actually having irritation.
Okay.
So they just damaged it further. So you have to be very careful with that.
Okay.
And in terms of pigmentation, that's the one that you really need to wait till you see the end of the light at the end of the tunnel.
It's exactly like dark spot is also like that?
Yeah, so pigmentation is dark spots. So it can be hyperpigmentation, brownish spots. It can be reddish spots. These are completely different.
Oh, okay.
But they take time and patience.
Okay, when we're coming to in this, what about the melasma condition?
Now melasma. Melasma is not something you can treat. Melasma is chronic, meaning you're going to maintain. You're trying to work with this chronic condition that you have. So it's not something that I can take away, I'm done. I treated it, it's clear now, it's over. No, it can have its triggers. You still need to be cautious.
Okay. What are the common mistakes that patients doing after aesthetic treatments?
Oh, okay. So now you're going back to my field. Okay. After aesthetic treatments, I would say is improper aftercare.
Improper.
So what I mean by that is not following the aftercare advice or using unsuitable products after the treatment. So lengthwise, but also product choice. And what you have to keep in mind is that after a treatment, depending on the severity of the treatment, of course, but after treatment, consider your skin a baby skin.
Oh, yeah.
It's delicate.
That much sensitive also?
Not that much, all treatments, but keep this in mind. It's delicate. Treat it.
Okay.
Like
it's like that.
Yeah.
So, must we use SPF after those treatments?
So, depending again on the treatment type. So, if you're using something like a CO2 laser fully ablative, you again have to be cautious with how you use sunblock and how you're going to be exposed to the sun at all, right? But that's an extreme case, right? So most treatments are not where you have to hole up in a dark cave. Others are you can still go about your life, but SPF in those cases are non-negotiable.
Oh, okay.
Yeah.
So back to the acne. When we're coming to the acne, acne is one of the most skin concern, right?
Yeah.
So can we treat it our own way, or we must go to the hospital or the clinics like that?
Okay, so you mean like is there topicals that they can use that are effective at home? Yeah?
Yeah.
Okay, so yeah, they are topicals that are effective, but of course don't think that, I'm saying this list, I must take one from each category. Please don't go and buy one from everything and then burn your skin. I'm just going to let you know, educational wise, what does work generally for acne, okay? So to simplify it, you can go with ABCs. A is your vitamin A's, so your retinols, retinoic acids, right? A is also azelaic acid, right?
Azelaic acid.
Yes. Then B is benzyl peroxide. Benzyl peroxide comes in a face wash, comes in a gel formulation. C is not actually C, it's S, but sounds like C. So for, ease sake. So C is salicylic acid.
Salicylic.
And then D is vitamin D. To remind you, SPF. Okay, it helps your skin. Even you're acne prone, you need that protection. And then you have E for exfoliants. And then H is to help you remind causation and also treatment other than topical.
Okay.
So H is hormonal. You think of lifestyle, you think of stress.
It depends on ours, right?
Exactly. So all of these are things that can cause acne, which you can work on, but also these are oral, sometimes medication that can help treat acne.
Okay.
Yeah.
It's exactly like that by taking medicine, like, okay?
So it's not necessary that, yes, I'm not saying go and, to the pharmacy and get your own medication. When you want medication, you come to the doctor, be cautious. But yes, it's sometimes for some types of acne, topicals is not enough and you need to get prescription.
Yeah. Okay. So when we're coming to the azelaic acid, can we use it all skin type, or what's the main concern of azelaic acid actually?
Okay, so again, it's not for all skin types. You have to see what's your concern. And the main function of azelaic acid is actually that it helps with antibacterial properties.
Antibacterial.
So it can help with certain types of acne. It can help with redness too.
So can we call it as a healing type of serum? Or an ingredient?
Okay, we want to go with marketing. Yeah, sure. You can say it's healing, but it can burn your skin too. It can cause problems too.
Really?
Yeah. It's a lovely multifunctional product, ingredient, but you misuse it and it will bite you.
Okay.
Yeah.
What's the main mistakes that we are doing when we're using this azelaic acid?
It's the same as what we've mentioned before.
Okay.
So about the overuse, about starting 0 to full force, about the concentration, right? And then also, because I know now azelaic acid is blowing up everywhere, there's, skincare companies, besides now our pharmaceutical that we've been using, for many years, skincare companies are formulating, and maybe there are ingredients within that product that can irritate your skin.
Oh, okay. Within any another ingredients we adding like that?
Yeah.
Okay, exactly. So, what illusion do people often have to do treating acne?
Okay. So a common one is that they come telling me that they assume if a product stings, burns, itches, then it's working.
Really?
Because when they treat an acne, they feel like it has to do something. Right, doctor? It's not doing anything.
Maybe it's a initial stage, right?
So it depends.
Okay.
It depends on the concentration you're starting with, the frequency you're starting with, your barrier before you start. So most of the time, just because it's active does not mean it needs to actively feel like it's doing something. More often than not, if you're feeling these things, if you're sitting at home and your different is feeling spicy, that means your skin is crying. Most probably it's crying.
Maybe they will skipping like that. If the initial stage is burning or exactly like that, the products they will skip. Like?
No, so this is actually the opposite. Yes, commonly you have people stopping products, skipping products. We talked about consistency. But a lot of acne patients, they actually think that, I have a condition. I need to see results for it to be working. So if they're not seeing clearing of acne, they're like, I should feel something. It's an active. Why is it? It must actively do something.
Yes.
So they think, it's actively burning, it's actively stinging, it's actively causing redness, irritation. That's it working. No.
So guys, that's exactly working. It's not working, okay?
It's probably your skin crying.
Yes, exactly. So besides home skincare and clinic treatments, what else is important for maintaining the skin actually?
Okay, so actually you would look at eating well, sleeping well, moving well, connecting well. So I'll explain a bit. Eating well, I'm talking about hydration and also your nutrition. Sleeping well, I'm talking about, yes, hours, but also respecting your circadian rhythm. And sleep hygiene is something that people need to incorporate in our day and age.
Yeah.
Moving well, cardio, but also strength training.
Okay.
connecting well is maintaining those social bonds, your social connections. And the thing is, in some situations, they found that the impact of social connections is comparable to reducing on mortality in reducing risk factors.
Okay.
So that's how important these aspects, these 4 aspects are. They will help not just your skin, they will help your hair, they will help your
Whole body.
they will help everything.
Okay,
Yeah.
so it's like that. Need to concern about not only externally, at the same time internally too.
Yes.
So if you can give a skincare advice to the audience,
Mm-hmm.
then what would it be?
Okay. You mean like just one thing?
Yeah.
Keep it simple. Keep it simple. Life is complicated enough. Your skincare does not need to be as well. Okay?
Yeah.
Take a deep breath. Your skin will thank you. Your wallet will thank you.
Yes.
Your analysis paralysis will thank you. So keep it simple.
Okay.
What do I need? What don't I need? And move from there.
Okay. So one of the main challenge that we are currently following the climate in UAE. So can you please tell me that what we must need to follow a concern when we are coming to the climate and how we can protect our skin from this climate?
Okay. So first and foremost, everyone's thinking it, everyone knows is we have extremely high UV index. So sunblock, and sunblock again. Okay. So the thing is, a lot of people assume that when you have a cloudy day, it's overcast, they think this is my chance. I don't have to wear sunblock.
Yes.
But take out your phone, check quickly. What's the UV index today?
Oh, okay.
Most often than not, it's a sandstorm and we have a high UV index.
Okay.
Okay, so wear your sunblock. Just do that quick check. Another thing is that people think that, I'm indoors. I just go from home to work. I'm constantly indoors.
Most people are saying like that. I'm not getting that much sun exposure because I'm only going to work exactly like that.
So they don't understand that UV rays are damaging through the windows too.
Okay.
Okay, you have to wear your sunblock even if you work from home, even if you
are working in indoor also.
Yes. Now, this does not mean I don't want you to turn into a vampire, close your shades, avoid all sunlight.
Yeah.
No, of course not, you need to be exposed as well to a certain extent for, your mental health. But take precautions. Avoid 10 a.m. to 4 p.m. That's the harshest time, right? Wear sun protective clothing, wear hats, wear your sunblock. So there are tips and tricks that you can do. You don't need to turn into a hermit.
Okay.
Don't.
Like yeah. So must use SPF.
And then also the type of SPF depending on your skin concern, skin type.
Yeah. Counterfeit skincare products are becoming increasingly common. What's the risk of that?
Okay, so when you have a counterfeit product, you can't guarantee that it was quality tested. You don't know its manufacturing process.
Yes.
You don't know the transport process, right? And when these factors are taken into consideration, at the very best, you will have no result. At the very worst is when you can have burns from excessive concentrations. You can have infection sometimes from contaminants. You can have skin irritation, dermatitis, pigmentation.
So many skin problems.
Yeah.
Yeah, okay. How can people easily identify authentic products?
It's not easy. Unfortunately, when it comes to skincare, the easiest way is if you've already used the product before, because then you can compare to what you used to. So by that, I mean, you can compare the texture, you can compare the smell, you can compare the color, if it's similar to what you've already used, right? Now, if you haven't used the product before, if it's your first time, that's when it becomes tricky because then you have to look at packaging differences, if there's missing expiration date or missing batch number, that can help you, but really it's really sad what's happening because as a consumer, as a patient, you don't want to play detective. You don't want to have to identify, am I purchasing something, authentic or fake?
And also, when people are buying the copy products of the exact brand.
So if they knowingly buying, they going into that, they should see the previous question, the answer. But if they unknowingly, that's when it's really sad.
Yeah, exactly. They don't know even the price, okay? They're buying the cheap prices like 20 or 30 dirhams, exactly like that. They're thinking it's exactly original.
Yeah. So sometimes, yes, unusually low prices can be a hint, but also see where you're buying from. Are you buying from a legitimate source, right? That can help you. It's difficult, it's not easy, and it's not something we should have to deal with.
If someone is starting the skincare journey, what are the main products that they must need to follow if they are a beginner?
Okay, so what they should start with, if they don't have a specific concern that they're trying to treat, then I would say it's your sunblock and your cleanser.
Okay.
Before, I may have added moisturizer, but we now have a very hydrating sunblocks too. We have those options.
Okay.
So your sunblock can function as a moisturizer too in certain situations. So yeah, I would say sunblock and cleanser to clean everything off at the end of the day.
Okay. So we don't need to apply moisturizer in the night time or?
No, you can, but you asked me what to begin with.
Okay.
So if you want to just be a beginner, a starting point, and you tell me I'm gonna just pick what they needed.
Okay.
Sunblock and cleanser. Yes, moisturizer is a plus minus, but you might be able to just choose a hydrating sunblock, and that's sufficient.
So thank you, Dr. Kala, for sharing your valuable insight with us. It was a pleasure that you on the podcast, and yeah.
So the pleasure was all mine.
Okay. And thank you to everyone for listening, and see you in the next video.